Dear friends, thank you for supporting ASON with finances, with prayer, and with relational support. You are deeply appreciated. ASON works in the Dominican Republic, Southeast Asia, and Ghana, West Africa. And all three of these fields, unfortunately now, are suffering because of the shutdowns the COVID pandemic has brought to them. As a result, people are literally underfed and hungry. We have sent funds to each of our fields as God has provided, but the need is very great. If you can send more help our direction for the needs of our people suffering from joblessness due to COVID, please go online to www.ason.org and donate to our COVID-19 emergency fund. You can mail checks made out to ASON and sent to P.O. Box 411210, Melbourne, Florida, zip 32941. On each of our fields, our nationals are working hard and using various communication methods to continue their work of evangelism and discipleship. Thankfully, in the Dominican Republic, Pastor Marino is using YouTube. In Ghana, Pastor Peter is using his radio station. And in Southeast Asia, they're making use of WhatsApp and YouTube, and soon Zoom. Universities and schools have all used social media in all three of our fields, except the schools in northern Ghana. There, the children do not have access to private computers and strong internet links. In Southeast Asia, Andrew purchased food and cleaning supplies, and his team prepared family bags, put on their masks, jumped on the motorcycle, and delivered them to people from their church, and in some cases to people who are not yet in the church. Andrew left one home in tears because a widow was quite hungry and not able to provide food for her children in the house. She was incredibly grateful for his help. He tells me that people are afraid to be tested for COVID because if they get it, they are required to go to the government hospital. But the government hospital lacks necessary supplies to prevent the spread of COVID, and they are overwhelmed, so that healthcare professionals are even afraid to treat the patients with COVID in some cases. And in some cases, they're even sharing a large ward room with people in body bags. BBC News reported that Mumbai's hospitals were on the brink of collapse, with people being treated in wards overflowing with patients. One of our pastors has no private toilet in his home, so that his wife and children are all forced to use a public restroom, which is closed at night. For $800, we can build him a toilet and protect him from undue exposure to COVID. The nation ended much of the lockdown on June 1st, despite a growing infection rate, and I am very fearful for India. In the Dominican Republic, our school teachers are without pay and many church people without enough to eat or buy medicine. Our school director lost her mother to COVID, though her sister and niece who did contract COVID have recovered. We have sent funds there to help, but those funds are already gone. The state of emergency in the Dominican was extended until June 13th. More than 515 have died there and 18,000 are confirmed with COVID-19. In Ghana, we have sent 2 batches of food to 5 villages. The food will soon be gone and they need more. Their jobs have not yet materialized and they are still shut in, though Ghana has begun somewhat of an opening by opening school only for those who will graduate at one level or another this year. God bless you as you consider how you might help by praying and giving. I deeply appreciate your continued support of ASON International. The amount of work that needs to be done is incalculable, and the needs never end. Thank you for being of assistance. I'm praying for you too. Bye-bye.